Welcome back. This is the last video where we are going to be covering bones of the skull, and we have two bones left to do, and so let's get to them. The first bone is what we're going to spend most of our time with, and this is the mandible. So remember, the mandible is your lower jawbone, and it is going to articulate with the whole rest of the skull that we've already discussed. When you look at the mandible, what you should notice, it contains teeth, and most of it is in a transverse or horizontal plane. But as you go posteriorly on each side, you can see part of it that goes in a more superior inferior direction, although at an angle and not a 90-degree angle. So the part that's in the horizontal plane, that is known as the body of the mandible. And so although we tend to usually only show one side because we have two bones, I want you to realize there's only one mandible. So that entire red area on both sides is called the body of the mandible, and it will contain about 16 teeth if you have all your teeth. The part of the mandible that contains the roots of those teeth is called the alveolar process of the mandible. So notice this is the same term as we had for the maxilla for the other 16 teeth. So there's an alveolar process in the maxilla and a different alveolar process in the mandible. The angled superior inferior portion is called the ramus of the mandible. And when you look at the ramus of the mandible, you can notice that there are two upward projections with kind of a U-shaped divot between them. And if you had it bone to look at, you would notice that this one, the more anterior one, is quite pointy. So it doesn't look like what a condyle should look like, the smooth rounded projection for an articulation. Whereas the more posterior one, if you look at it, is quite round and smooth. So it's this posterior one that's going to be articulating with which bone? That's right, the temporal bone. So the part that articulates is called the mandibular condyle. So the mandibular condyle is of the mandible, and what it articulates with is the mandibular fossa of the temporal bone. So if that's the mandibular condyle, then what is the more anterior one? Well, that's a coronoid process. Remember, we have previously had a coronoid process in the ulna, because the word ulna fits right here, but so does mandible. And also recall that coronoid is an all or nothing spelling word, because you can change one letter and only be one letter off the coronoid process, which is in the scapula. So be very careful with those two words. So a few more landmarks about the mandible. The area where the body meets the ramus, this part right there, is called the angle of the mandible. Oftentimes we call it the angle of the jaw. You can find it on yourself. Go anterior to your ear, find the mandible, and then you can clearly find the angle of it before it comes anteriorly. That's it for the mandible right now. We will come back and revisit the mandible later on when we're talking about the foramina of the skull. So that brings us to the last bone in your body, which is this tiny little bone, which is totally U-shaped. It looks like it has a couple little fangs in an upward direction. Can you see those little fangs there? That's how you know the superior aspect, because it's got those little fangy things going out. And this bone is the only bone in your body that does not articulate with any other bone of your body. It's only attached to them by muscles and their tendons. Now, where this bone sits is right here. So it's tucked inside the mandible. So if you have your mandible like this, the hyoid bone sits like this. So normally it's impossible to fracture this hyoid bone because it's totally protected by the mandible. So there's two ways to fracture this bone. Number one, have blunt trauma to the face, which totally destroys your mandible. Well, then yes, you're going to be fracturing your hyoid bone. But the most common way that this bone is fractured is when people undergo strain. Can you see how I am behind the mandible, but still anterior to the hyoid bone? Yes, so in suspicious tests, that's what the coroner does. They take an x-ray. The hyoid bone has been fractured. The person has been strangled. Okay, so I know that was not a very uplifting part to end, but that's one of those, you know, pieces of trivia that you can share with your family to, you know, like, let me tell you what I learned. You got this really cool bone, the hyoid bone that breaks when you're strangled. All right, so thank you once again, and we will come back later to talk about the foramina of the skull, as well as other structures.